welcome to covering the phenotypic models of autism in rodents. So we're going to talk about kind of three different models. Well, really two models. First, we're going to go on some tangents about oxytocin, and then we're going to talk about BTBR and BALB mice. There's other letters in there. You guys can read. And then we're going to talk about microtin rodents. So first, let's get on to that oxytocin. So oxytocin, which will be abbreviated mostly as OXT. If you see just OT, that's also oxytocin. I get confused sometimes and forget the X. So if you see OT, it's also oxytocin. Anyways, so oxytocin has been contributed to be associated with ASD, and pretty much we've got a hypophyseal peptide hormone that's released into the posterior pituitary. So that's over here. We've got the entire pituitary gland. There's the anterior pituitary and then the posterior pituitary, and the posterior pituitary is there, and it sends information to the hypothalamus. And the normal roles for the posterior pituitary and the hypophyseal peptide hormone release is part of reproduction, labor, and lactation. So again, normal release of this hormone is involved during those times. However, recent work recognized a role for oxytocin itself in a pro-social behaviors. So oxytocin is also released in this posterior pituitary. So in this diagram, then oxytocin is the pink dots. So it's sent from the posterior pituitary gland to the hypothalamus, particularly the paraventricular nucleus within the hypothalamus, and it's involved in those prosocial behaviors. So oxytocin is a pituitative pharmacotherapeutic for social affects in ASD. In other words, if we give more oxytocin to patients and we can get it up here into the hypothalamus via the posterior pituitary gland, then perhaps we can help with some of these social deficits in ASD. Okay? So, there have been some therapeutics developed so far that focus on the pituitative oxytocin. So as a peptide hormone, oxytocin administration is challenging because it gets broken down quite quickly in the body, so that's the rapid catabolism, and it has trouble permeating the blood-brain barrier itself, so it's really hard to get it into the brain via like oral or intranasally or whatever. It can be hard to get the oxytocin into the brain itself. And it actually has a half time of about 3 minutes when it's injected in the blood. So, that doesn't give it a lot of time to cross that blood-brain barrier and actually act to do what we want it to. However, there have been a few different therapeutics that have been developed over the years to kind of address these issues of it being broken down so quick, as well as its permeability. So we're going to skip the first one real quick, and we're going to go to the second one. So this is a non-peptide agonist, has been developed. So this helps because it's a blood-brain barrier permeable agonist for the oxytocin receptor. In other words, it's an agonist that can go past the blood-brain barrier a lot easier than oxytocin itself because it's not a peptide, so it's smaller. Remember, peptides are a lot bigger than, say, just a neurotransmitter. And because it's an agonist, then what it's going to do is it's going to kind of pretend to be an oxytocin peptide, and it's going to be able to connect to the receptor and turn it on. So it's going to be able to have the same effects of oxytocin, but it's more permeable to the blood-brain barrier. Another therapeutic that's been developed is an oxytocin releaser. So this is an agonist to stimulate oxytocin-releasing neurons. So this is using the oxytocin your body already has, and it's simply just stimulating your body to produce and then release more oxytocin. So obviously that one's also pretty good because that way the oxytocin's already in the blood-brain barrier. You don't have to worry about that. The last one is the PLAP inhibitors. So these are antagonists of placental leucine aminopeptidase, which is the enzyme responsible for degradation of the oxytocin. So in other words, what it's doing is it's stopping the breakdown of the oxytocin so that the oxytocin is able to stay in your system longer and actually able to do its thing. Now, all of these, these are therapeutics, but they're in the really early stages. They haven't at all moved out of the animal stages at all yet, so they haven't been tested on humans yet. However, if we talk about the first one, which is an intranasal oxytocin, so this therapeutic is an intranasal, kind of like it's a spray, you spray up your nose, of oxytocin, and the benefit of this is it allows rapid access and moderate permeability across the blood-brain barrier. So the nasal cavity is the quickest route to the brain. It's the closest orifice to the brain, really. And so if we're able to get the oxytocin in the nasal passage, and it's going to be quicker to get to the blood-brain barrier, and we have moderate permeability, so a moderate amount of the oxytocin is able to get across. And what we found is that this intranasal oxytocin is actually kind of the most advanced of these therapeutics, and we have multiple ongoing human trials. So an intranasal oxytocin is currently in phase 2 of clinical trials for autism patients. It's in phase 3 clinical trials as a way to treat lactation deficiencies. And it's also in phase 2 trials for schizophrenia therapeutics as well. So there are some, multiple uses for this intranasal oxytocin. Now, let's talk about another, let's just talk about an actual model now of ASD, and this would be the BTBR T plus TF/J mouse and the BALB/C mice. Pretty much these are strains of mice. It's 2 different strains of mice that are inbred and screened for variations in social behavior. So rather than being a genetic model, so we haven't altered their genes at all, we're just doing selective breeding. And so that's why it's a phenotypic model. And both of these strains of mice have shown reduced social behaviors, as well as decreased vocalizations in general, and decreased scent markings. They don't do those social behaviors that we usually see in normal mice. Now, the BTBR mouse does show altered oxytocin receptor system. So OTR is the oxytocin receptor. But the BTBR pups actually show increased isolation-induced vocalizations, So that's using that model that we talked about, or the test we talked about before, the test for communication deficits. So this strain of mouse, the BTBR, isn't a great model to use that test on because these mice do show increased isolation-induced vocalizations, where we usually see decreased in the ASD endophenotype. We do see variations in inbred strains that arose through independent selection. So overall, we see low construct validity with these models of mice. Now, the last type of phenotypic models is the microtin rodents. And so these are using rodents other than mice and rats. So really we're going to focus on voles mostly. And so the voles of the genus Microtus have very interesting patterns of social behavior. So there's specifically the prairie moles are very interesting because they form monogamous bonds. So like humans, they form monogamous lifelong bonds, which actually the majority of species in the animal kingdom don't do that. Only 5% of species actually engage in monogamous bonding. And so the prairie voles specifically are one of these types. And so what's cool is that we see the shared huddles, grooming, and nesting, as well as shared pup rearing responsibilities. So we see a lot of this shared social behavior that kind of mimics what us humans do. Now, if we look at a closely related species of voles called the meadow voles, or the montane voles, they actually inhibit solitary burrows and lack any of the bonding characteristics. So the prairie voles are pretty special, whereas these other voles don't do that. So what we can do is we can study these rodents. We can study the differences between these prairie moles and the montane voles to show a high variability in social behavior. And so because the prairie vole is highly affiliative and socially monogamous, then again, that's related to, say, what we call a normal or healthy human patient, whereas the montane and meadow voles are asocial and non-monogamous. So they would have the endophenotype most similar to the ASD patients. So the differences in developmental and neurological basis of social behavior have then been applied to ASD. So the differences between these two in the development and neurological basis of social behavior, they've actually generalized this to ASD patients. So this is a general model for social behavior, not really specific to ASD, or it's not always specific, but it's kind of been generalized to ASD as well. So while it's a good model for showing differences in social behavior, it does not have a good construct validity for ASD. But again, it has decent base validity. So we can still see how these microtin rodents differ. And what we see is that the highly social prairie voles, which is on the right here, they have an increased oxytocin receptor expression, especially in the nucleus accumbens. So the darker the color, the more of the oxytocin receptors. And so we see how it's a lot darker here than it is in the montane voles, which, remember, the montane voles are not as social. And then we also see that parental care behaviors are correlated with this oxytocin receptor density. So the more dense of the oxytocin expression, the increased parental care behaviors we see. And as well, our oxytocin expression in the nucleus accumbens is proposed to reinforce this social behavior. So again, we do have a lot of limitations with this microtin rodent model. First off, there's just flat out zero construct validity. We do have limited predictive and face validity. Again, for all of these models, predictive validity is always going to be limited because it's just hard to test. And we do have limited face validity. But it is a useful model for studying the general neurological correlates of social behavior. So again, it's more of a model for social behavior and not so much of ASD. So we should also talk about some early life interactions, and we're going to talk about how that kind of relates to this. So maternal care is associated with an increase of oxytocin function and release. And so we see this in rats, humans, and as well as in these voles. And then maternal separation will actually decrease the expression of oxytocin, particularly in female offspring. So in humans, the early childhood neglect is correlated with a decrease in oxytocin levels measured in the urine, and adult women that were exposed to abuse as a child have this decrease in oxytocin levels in their cerebrospinal fluid, so even as adults. So this maternal separation at a young age will cause lifelong depletions of the oxytocin release. As well, human infants that have high parent-infant synchrony, so enhanced capacity to respond to an infant's social affective signals, have increased oxytocin levels in the saliva compared with low parent-infant synchrony. In other words, when the infants and the parents are able to kind of understand each other better, then that's usually associated with that higher oxytocin levels. And with lower oxytocin levels, the parents and infants aren't able to really respond to each other as well. They don't understand each other as well. And this effect does seem to be cross-generational. So human parents with high parent-infant synchrony also show increased salivary oxytocin. So again, if you had this when you were a baby, you had high infant-parent synchrony, then when you become a parent, it's most likely that you and your infant will also have high infant synchrony. So finally, we're going to talk about some of the early life social interactions that can go on to affect adult social behaviors. So early social deprivation includes changes in the social behaviors that persist into adulthood in animal models. So this would be impaired maternal care, increased or decreased aggression. And so this is species specific. So depending on, what the normal level of aggression is for a species, as well as impaired social recognition. If we see this in if this all occurs in the young animal, we'll see impaired social behaviors in the adult animal, so as they grow up. And so the female offspring of low licking or grooming dams, so those are the mom rats, they show earlier sexual receptivity, and the male offspring of low-looking grooming dams show an increased dominant play-fighting behavior. And so the early social deprivation and enhancement leads to correlates in this oxytocin system function and social behaviors. So there's actually a lot of current studies going on right now that are investigating the causality in animal models and what more effects that these types of behaviors can have on both the oxytocin system as well as in the ASD patients themselves.